On this gentleman right away, I'm seeing something with the legs. What do you see?
I do see.
Look at
Wait,
that. Whoa.
what do you think of that?
I think we got some bow legs here.
Agreed.
And yeah, femurs need work.
Now it would be interesting if this gentleman bent his knees and we saw what happened. Let's look at his backside relative to those legs. If we're going to look at the front, let's look at the back. There's a lot of non-development on the calves in the back, unless that's a very strange photo. But do you see how there's not a lot of gastroc or the big one at the top?
Right.
Mm-hmm. Especially on the right. I don't know if it's a shadow, but there's a discrepancy. I'd be interested if on his health history.
Yeah.
Because that's very little muscle on that right leg.
Right.
The,
Interesting. But these bow legs are kind of gnarly.
the bow legs, they're gnarly if you don't understand them.
Yeah.
But because we also see that his feet are turned out, but he also looks bow-legged, as you say, and then it looks like he's kind of going in. They can call this tibia torsion. It's like basically when two parts of the bone are going in different directions. Typical in men, typical in runners. And as you can see from his lumbar, right, his low back, there's a lot of tightness up there. So
Hmm.
he's strong, weak. He's a strong, weak guy.
Yeah, look at that.
There's
Look.
a lot going on there.
Yeah. Big anterior pelvic tilt too.
Well done, doctor.
Look at
Well done.
that. Look at
And
that.
this guy works out, I think. Yes.
Yeah. I don't know if he works out now, but I do know he played a lot of basketball.
Played a lot of basketball.
Yeah.
This makes more sense. This makes more sense. Interesting. The calves make more sense after you tell me he played basketball. And I'll explain that more because of the capacity to jump is different. The leg, as weird as it sounds, this makes more sense because he's got a very long, skinny leg. But if he's playing basketball, that means he's got a lot of dexterity in his ankle. So he's probably driving from the part we see tight, and his ligaments or his Achilles has to really give him a lot of spring, especially with basketball, right? Because you're up, down, side, side, forward, back.
Right.
This makes more sense when you tell me that. But you can see above, he's tight. We could help him for sure.
He's got strong glutes, right? Look at the
Really
right
strong
side
group.
is more revealing than the left to me.
Mm-hmm. He's a strong guy. He just needs lengthening. And he's gonna, well, again, the basketball makes so much more sense.
And look, his hip is out in front, his knees
Mm-hmm.
out in front, but his
Is
shoulder
it?
is out front.
If someone took his ears
He's got a right rotation.
and pulled him all the way up,
Yeah.
he would unwind and get taller.
Mm.
How tall is he? Do we know?
He's about 6'1", I think.
Okay.
6'1", 6'2".
So this makes more sense now. I've worked with some professional basketball players. It's why I do like to know about my client, because this muscle structure here, I have seen on basketball players. And if you actually look at some basketball players, like professionally, sometimes there's the chicken leg guy, is really good under the basket. He's got a great vertical, doesn't run too good. But this is a different muscle here. So that will be interesting. Very much.
Right.
If I show you, let's see, I don't know how to get off of yours.
Yeah. Can we go inside the body? Can you show me something
Ah,
up here?
I have to take that one off, yeah.
Can you share something?
How do I get your screen off? I guess we do have to swap.
Yeah.
Okay, no worries.
Here we go.
So this is where I think it's great for athletes who are strong like this gentleman we're looking at, right? Okay. Hopefully you guys can do this with me. When we sit down, and you're a tall guy, especially like gentlemen, your knees often get higher than your pelvis. Like you're sitting under a desk or he's trying to do his daily work. You're also telling me he does a lot of basketball, which means he's going to be in an activity where he's, down with the knee. When the knee comes to a certain height, this part of your back lengthens. And it just happens. You go into what we call a posterior pelvic tilt. It happens. It's meant to happen. However, if you're real tight here, like our friend, and he goes to do an athletic endeavor where he's going to get really down low. I mean, basketball's low, right? You're dribbling. It has actions like that. So if he's tight in that low back and he goes to do something like a layup, and that's supposed to have some recoil and length, he's stuck. Hence your anterior tilt. He stays in the anterior tilt when his back is supposed to lengthen when he goes into a deeper sit or a squat. So it's often why we tell an anterior pelvic tilt person they need more abs, or they need to learn how to do this side of the cat dog. They need to learn how to move the pelvis on the leg to lengthen the back.
Right.
What you're seeing here is a lot of times people, they don't know what their hip looks like, right? So this is the back of the hip. This is your butt, people. These are your ligaments. It's deep in here. So a lot of people are like, if I went right here with my, as you see this is a nice cherry booty right there. But when you have no booty, and then there's a whole group of people who are stuck in this position.
Right.
Posterior tilters, which is why you guys have a really hard time walking. Because to walk, you need to be able to go anterior tilt. So a huge part of what we do in posture therapy is to balance these imbalances. Some people just think, oh, I can never let my pelvis go posterior. Of course you can. But here, like I'm actually sitting on the floor like this right now, and I am sitting on a pillow. I put a pillow under my butt to lower my knees. People working out who are tight like that guy, he's going to go do a workout and he's never going to be able to open his backside. See, I didn't even have to do that one. But that's why I say athletes. Athletes sometimes actually get themselves quite tight and in a mess. So if we go back and look at our friend, if I did a postural test with him and I was like, hey, stand on one leg, I would be looking to see if he could go through this full range of motion. I'd ask him how big, how high can the knee go? And he's either going to stabilize well or he's going to rotate. Right?
Right.
And that's why we get these spirals. And a lot of our clients come in going, I have this pain, Dr. Reese. I can't identify it. Can you help me? Oh, I lost you. So again, look at this whole area of this gentleman. It's taken control of everything else. That's all.
So what do you see with shoulders? Because he's reporting shoulder pain.
Yeah. Well, here, you see this part right here, these wings, these little wings.
Yeah.
Right? We've talked about winging.
Serratus.
This what? Tell me again?
Serratus.
Yes, doctor. Well done. Serratus and lower trapezius and middle trapezius are compromised. So the serratus is here and the trapezius is here, right? So let me see if I can go find that for you.
What's this right here? Ooh.
I don't know. It's either a shadow, I don't know. Right? I don't know, but I know like below.
I mean, it could just be a tight muscle.
It could. If you go below, all you have to look is here. This is what I see. You see this? You see this little thing right here?
No, I don't see your screen.
Oh, not at all.
No.
Do you see my little pointer?
No.
Oh, well, then that makes a lot more sense. His low back. Literally, if you look at the creases of his low back, almost where there's a tan line on his spine, it's wiggly. He's really tight back there. And that's messing up his shoulders.
Yeah. And they're definitely off. Look at that.
Spiral. So we just looked at the video before. So if this gentleman's sitting And he's sitting in a low chair, which happens to a lot of tall guys. Hence, I just showed the video of the knee being higher. Doesn't have to be exponentially higher. But if you take a tall person and make them sit at a desk all day, they'll tell you like, oh, my knees keep hitting, and they got to get comfy. So they do everything but sit well, or are able to be well in the sense of when they sit down,
Right.
their back should open and lengthen. His doesn't, period. So he twists. When he twists, his shoulders go off. And like you just said, that winging tells you that he's real tight in the front, but we know that. That's why I asked if he trained. From the front, he looks pretty cut.
Yeah.
It's only from the back that we can see he's out of bounds. Like, it's like, man, he keeps doing chest, but he needs to do arms. He needs to do some flies. He needs to put some energy into pelvic stability so his shoulders can work well.
Yeah. A little difference in the arm windows too.
Little difference. He's just so darn tight. I mean, he's like a leg warmer that's gotten scrunched around the middle. But he's in a really good place because he's got core, he's got tone.
Now it's hard to see his knees because this photo is dark, but
his knees will feel better when his pelvis is less tight.
Yeah.
Because right now they're locked in. But he would really be interested to, I mean, he's a classic anterior pelvic tilt. It sounds strange, but he needs more work on his hips.
Yeah.
And more stabilization in his core, even though he looks really strong.
We got a puppy dog posture up here too.
Yes, sir. Look at that. See rotation.
Head is crooked.
Yeah.
I can't tell if that's a chain there, but there is a crease.
I don't think so.
There's a crease in that neck.
He's got a really forward head posture. Look at the chin.
Oh, yeah. There it is.
Look at the chin.
There
So
it is.
literally, let me see if I can find it. Hold on. Oh, am I allowed to get off your screen? I have just the picture to show you.
Okay.
Okay, how do I get back to my screen? Okay. Then this one, I had this one pulled up. All right. Sorry, guys. Torso. Nope.
Yeah, we just put him on the 90 essential nutrients, so we'll see how he responds.
Oh, that'll be really nice.
Trying to get him
Okay,
off his little gluten addiction.
Oh, that will be interesting.
Yeah.
Indeed. All right, so it wasn't the one I was going to show you, but
Can you share
it'll work.
screen?
Yes. All right, here we go. This one. Share screen. Stop. So this comes from a body of work called.
I don't see it yet.
I know. Hold on. Ah, where'd you go, doctor? It says, hi, Kevin Reese. I'm like, where's Kevin? Where's Waldo? There he is. For all the parents out there. All right, share screen. Bravo. Here we go. Boom. This is really important for all of our clients, not just this gentleman, okay? So I hope our people come back and watch these, even if it's not about you, because there's information here.
Yeah.
This is why people get twisted, like our gentleman with you just described. Probably all the people we'll look at have some sort of twist. In your body, you have muscles, ligaments, tendons, fascia, bones. Fascia, a lot of people don't know what it is, but if you think about taking a chicken breast and pulling that white fibrous stuff, when you strip it, you take not the skin, but the white, yes? If you're a vegetarian, it's equivalent to the white between the orange slices and the rind, right? There's a structural part of organic things that get held together by this webby, wet, dry thing called fascia. When it gets too dry, it does not work well. So hence nutrients are going to be really important for someone like him because he's tight, he's not missing tone, but he's probably dehydrated and pulled down. So when we look at this spiral, I want people to realize these are not muscles. These are how they work in one, right? Like when we walk, there's lots of muscles happening. We can't possibly speak of them all. But if this fascial line from the work of Tom Myers is crooked or pulled, the whole system cannot balance. So the spiral line is critical, and we're just going to look at it for a minute. And I just want you to watch this. Here's your serratus, buddy. Just so you know, there they were. Here's our gentleman's calf. Now we're up the back. There's your hamstring, goes across the sacrum, through the back. This is where all his chunkiness is. And it ends over there on the other side of the neck. So this side of your neck is completely connected to the leg. And I mean, I can pause it anywhere along here. He's doing a great job, the little man here.
We're all connected. We're completely a unit. It's just amazing.
So this is a book. I mean, if people want to nerd out, this is a whole body of study. You might know Rolfer's Structural Integrist, Ida Rolf, which is really cool because a lot of body work has been pioneered by men, but Rolfing and fascial a woman, Ida Rolf. And okay, we're going to do it only one more time because this time I want to stop it. I'm going back. All right, I love this part because you said it too. You see these guys right here? Serratus. Right? See how the scapula sits on the serratus? And here's where he wings, right? So if I go back a bit more on this spiral line, oops, they go fast. I can see it from behind. You can see it. When that scapula doesn't have correct, then this doesn't work. Those are the abs, the obliques. This is the IT, why he's so tight. So imagine that stuff on the outside of this leg so tight, creating hence that bow-leggedness.
Yeah.
Because you can see we're out of balance. Anything on that line is like a map. The rhomboids, serratus anterior, right? They're a team.
Right.
And when they don't work right, the obliques, which is where a lot of people know, like, oh, I do my oblique exercises. Not if you're messed up in the shoulders. Everybody usually who knows this one, that's the TF, the ITF, the band. This is the front shin splints. If anyone's getting shin splints, this is your fascia, the feet fascia, all of it right there. That whole thing he just did. That's why that boy is more bow-legged. It's just that whole thing is like twisted and smooshed. But I just want people to start realizing too, like you can come to us and be like, this one thing hurts. And it's so easy to speak to them if they understand everything's connected, from nutrition to their mind to, and there's a lot to be said about those spirals. Did I lose you? I can't find it.
Yeah, you can unshare your screen now.
You share, unshare. Unshare one participant. Hey, you know there's a button that multiple participants can share at the same time? We need to find that button.
All right. Well, the bottom line is we can help this gentleman, and we are looking forward to it.
Yeah.